Hi folks, welcome to this video on joint actions and muscles. So this video is now the time to look at the individual joints and see which muscles are contracting to create which movements. So there's also a video in this playlist to do with the movements that you can get at which joint. So if you need to recap that, please watch that video first. This is dealing with the muscles that are contracting and the movements that are taking place as a result. Right. Joint actions and muscles then, there are a few key terms that we just need to make sure we're happy with first. These are agonist, antagonist, fixator, and this thing about antagonistic muscle action. So let's quickly define each of these. So the agonist is a muscle that contracts to produce the movement and is also known as the prime mover. You might have heard it as either one of those. So as an example there, a very basic example, during a biceps curl, the biceps is the agonist, or the prime mover. That is the muscle that is contracting to create the major movement at the elbow joint, which we're going to have a look at in a few minutes. The antagonist, in contrast, works in opposition to the agonist, and as it says there, relaxes or lengthens as the agonist contracts. Now, just to clarify, when we say works in opposition, it doesn't mean it's trying to oppose, it's trying to stop the agonist from doing its job. It's happy for the agonist to do its job. If we come back to the example that I've mentioned, biceps curl, the biceps will be the agonist. In order for that biceps to contract, the triceps on the back of the arm must be the antagonist. It must relax in order for the agonist to do its job. So they are a partnership, they work together. Equally, if we was to turn that bicep curl into a tricep, extension, a dip, something like that, the tricep would then become the agonist and the biceps would become the antagonist. So they work in opposition in terms of as one's doing one thing, i.e. contracting, and the other one's doing the opposite, i.e. relaxing. The fixator, that might be a new bit of terminology to you. The fixators contract to stabilise or fix the joint and or body in position. Now, what do we mean by that? Think about, there's this big thing about, when you go to the gym, try and use free weights, try and use dumbbells, try and use bars, as opposed to the fixed weight machines where you're sitting in a seat. The reason is when you are standing doing weights exercises, you are contracting a lot more muscles because you're having to fix your body in position. Think about the bicep curl again. When you do a bicep, you're in a standing position. When you do the bicep curl, the bicep contracts to flex the elbow. The biceps is the agonist. At the same time, the triceps is going to relax and that's going to be the antagonist. But at the same time, you are contracting a lot of muscles around the shoulder joint, around your spine, around your hips and your knees to fix your body in a nice stable position. So they are still contracting, and we call those muscle actions and those muscles fixators. They are fixing your body in position in order to allow the required or desired movement to take place. So if there was to get a question specifically about a bicep curl, for example, the fixators you'd be interested in would be those around the shoulder joint and the wrist joint, fixing the wrist and shoulder in position, so the only movement you are getting is that is wanted at the elbow joint. But it leads me on to a key thing that can sometimes come up, a key fixator in the body. There's a key fixator muscle group we have in our bodies. We all have it, we all need it, called the transverse abdominis. So as you can see, here's your rib cage here, there's your pelvis, the ilium part of your pelvis, and there's your transverse abdominis. You've got one on this side and you've got one on the other side, and it wraps underneath. So your six-pack, is on top there, your rectus abdominis is on top there, but this one wraps around you. It's basically like a corset. Every time you want to lock your core nice and tight, you think it's the abs that are doing it. It's not. It's your transverse abdominis that are contracting nice and tight to keep your core nice and fixed. And we call it a core stabilizer. Any of you that do core stability training, you are specifically trying to strengthen this stabilizing muscle group. Now, you might get questions on core stability of the spine, or how do you increase core stability, or how do you generate, or what's a key fixator in the body. Transverse abdominis, this muscle here is the key term there. That's the muscle that we associate with high levels of core stability, one of the big fixators of the body. But like I said, any muscle that is contracting to fix a body position is classified as a fixator during that action. So finally for this slide, what is this term here, this antagonistic muscle action? Is basically what we've just said in terms of when one muscle becomes the agonist, its opposite muscle, its partner, is probably a better way to do it, becomes the antagonist. So when I do my bicep curl, my biceps is the agonist, the triceps is going to become the antagonist. If I then decide to extend that elbow joint and now do a tricep extension, the tricep would then switch and become the agonist, and the biceps would become the antagonist. So the fact that these muscles switch from agonist to antagonist, depending on the action, we call that an antagonistic muscle action. So that's just the key term there to describe the fact that the agonist does its job and at the same time the antagonist does its job, and then they can switch over if you decide to do the opposite action. That will hopefully make more sense as we go through these. What we're going to do now is look at the actions, the muscles at each of the key joints that we need to know. Let's start with the biggie, or one of the biggies, the shoulder and the hip joint. Because they have ball and socket joints, they have the most amount of movements, therefore the most number of agonists and things like that to remember. So let's deal with this one first. The shoulder joint has got a lot of movements, as we mentioned, therefore we need to know which muscles create those movements. Like I said, if you're unfamiliar with the movements, you need to watch the video on movement analysis, because I'm just going to say the terms and expect that you know them or presume that you know them. So there are all the muscle actions, the joint actions we can get at the shoulder joint. We can flex. Remember, that is where you swing. I swing this entire arm forwards, so like an underarm throw is an easy example of that. Extension is where this arm moves backwards behind my body. Abduction is where this arm comes out to the side there. Adduction is bringing it back towards the middle of the body. These are two that can cause confusion. Medial and lateral rotation. Look at this humerus, that bone in the upper arm there. If I was to rotate that arm away from my body, so like twist the arm away from the body, that would be lateral rotation. If I was to rotate the arm so it is pointing towards the middle of my body, that is medial rotation. Horizontal adduction or flexion are the same. That is where my arm comes up to the side and I move it behind me. Horizontal adduction or flexion is where I bring this arm up in front of me and across my body that way. And horizontal abduction or extension is where I bring this arm up to the side, so I abduct it and then I move it behind me, rotate it behind the back of my body. Like I said, I'm not dealing with the movements in this video, that's in the other video, so you need to look at those. Let's look at the muscles that create these actions then. So these are all the agonists, right? Now, panic automatically kicks in because a lot of terms you're not familiar with, a lot of muscles you've not heard of. Just calm down and let's look for the easy things to get our heads around. Well, first of all, look at this. Deltoid, 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 deltoid. So deltoid is, I've put a couple there by mistake, but you can easily put them there. Don't worry, it's not a different muscle. Deltoid is very, very useful muscle to know. However, don't just put deltoid. Anterior means front, posterior means back, and middle means middle. So what do we mean by that? Well, let's just have a look here. If I was to just very crudely turn this deltoid here into a circle, okay, what we're saying is, here is the front of the athlete, so this third of it at the front is called the anterior deltoid. The third at the back is called the posterior deltoid, and the third in the middle is called the middle deltoid. So, if I contract my anterior deltoid, it's going to pull this entire arm forwards, and I'm going to get flexion. If I contract my posterior deltoid at the back here, okay, it's going to pull my entire arm backwards, and I'm going to get shoulder extension. If I contract the middle third of my deltoid, it's going to abduct, as it says there, middle deltoid, abduct, and bring the arm out to the side. So one muscle group does three of the key muscle movements at the shoulder joint. Where it gets a little bit different is, if we see here, your latissimus dorsi, your lats are these big muscles here. Now, yes, they're attached on your back, but look at that point there. It just goes up. In fact, let me just change this. You'll see here a little bit better. It just goes up there into the back of the humerus joint. So when you contract your lats, it pulls this arm back down towards your side. So it adducts, it brings the arm back to the side of the body, the shoulder back to the side. These are some of the little weird ones now, okay? what you can see here is teres minor. Teres major, don't worry about it. Teres minor is that one there. This is called, or one of your rotator cuff muscles. So if you've ever heard of anyone with a rotator cuff injury, teres minor and subscapularis are two of your rotator cuff muscles. You're just going to have to memorize these. The teres minor laterally rotates. So when you contract your teres minor, you are rotating your entire arm outwards, away from your body. When you contract your subscapularis, sub meaning below, as in submarine, and scapularis, as in scapula. So you can't actually see it on this diagram. Your scapula is somewhere here, underneath the muscles, and the subscapularis is below the scapula, underneath it. When you contract your subscapularis, it will medially rotate. So that is rotating your entire arm towards the middle of your body. Finally, horizontal adduction and flexion, bringing the arm across the body in a horizontal manner. That is your pectoralis major, your big pec muscle groups on the front of your chest. And finally, the posterior deltoid gets repeated again in terms of it is involved in horizontal abduction. So as well as this posterior deltoid here, as well as extending the arm, bringing it behind the body, it will also abduct it and horizontally abduct it, back at the horizontal abduction one. Think of like someone like Andy Murray's arm position on the back swing of a forearm. The arm is up, out to the side, and also behind his body slightly as he's about to strike through. That's a horizontally abducted position. So in order to get the arm in that position, that is the posterior deltoid. Right, they are not all as complicated as the shoulder joint, so don't be getting put off, but you're going to have to remember these agonists, these muscles that contract, that create these movements. Much easier then is the elbow joint. Why? Well, because of the type of joint it is. It's a hinge joint, so it can only do two movements. The elbow joint can only flex or extend, and just to recap that, what we're talking about, remember flexion is the elbow joint doing that. You are flexing. Extending is the arm doing that, straightening your elbow joint. And as you can see by the diagram, you've got the names of the two agonists there. Now my advice, I know it's going that little bit of extra mile, but don't give them reason to dock you a mark. Don't put bicep and tricep. You're A-level students now, you're better than that. Biceps brachii, or brachii, or brachii, whatever you want to pronounce it, that is the muscle that contracts to flex the elbow joint. Triceps brachii is the muscle that contracts to extend the elbow joint. And as we said, these are examples, the example that I gave you at the start in terms of agonist and antagonistic muscle pairs. So just to quickly recap that whilst we're here, as that elbow flexes from there to there, the bicep contracts and becomes the agonist. The tricep, even though it's not on this picture, obviously is still there, it's going to relax to become the antagonist. If this person then decides to extend their elbow joint, the tricep will contract to become the agonist, and the bicep will relax to become the antagonist. And that's that antagonistic muscle pair, muscle relationship. If it didn't get any easier, it's just about to. I think the examiners feel guilty about the whole shoulder situation. The wrist joint, there are lots and lots of muscles inside your wrist, inside your forearm. However, at A level, we group those muscles together. Even though some of you know that the wrist pronates and supinates and all this kind of stuff, we are just interested in flexion extension at the wrist joint. So flexion extension, and if life didn't get any easier than that, it's just about to. The muscles that contract to flex the wrist are called wrist flexors, and the muscles that contract to extend the wrist are called wrist extensors. So flexing the wrist is bending, so the palm of your hand coming closer to your forearm, and the wrist extension is the back of your hand moving closer to the opposite side of your forearm. So wrist flexion is bending the wrist forwards. Wrist extension is bending the wrist backwards, and it's the wrist flexors and the wrist extensors that are the agonists for each of those actions. So that's really straightforward. So the hip joint then, again, it gets a little bit trickier here because, again, it's a ball and socket joint. We have lots of different movements, therefore lots of different agonists. So the hip, we are talking about that thing there, that ball of the femur fitting into that socket of the pelvis in the ilium. So there's the ilium, there's the ischium, there's the pubis, and the head of the femur just fits into the socket there. So there are the muscles that we're interested in. As you'd expect, a lot of them very similar to, or exactly the same as the shoulder joint, because it is the same type of joint, ball and socket. So we've got flexion, extension, abduction, adduction, lateral rotation and medial rotation. The only ones we haven't got are those horizontal ab and adductions. So flexion, remember femur forwards is flexion. Every time you see the femur, this bone, this bone swing forwards as if you were kicking something or raising your entire femur up in front of you, that would be a flexion activity. Extension is moving the femur behind your body. Abduction, raising out to the side. Adduction, bringing it back down to the middle. Lateral rotation, maybe I didn't explain it, I never do explain these things too well, but lateral rotation, like I said in one of my other videos, if you draw a line, not the best line in the world, down the middle of that leg there, if you then twist your leg so that line is pointing this way, out away from your body, that would be lateral rotation. If you then twist or rotate your leg so that line is now pointing towards the middle of your body, that would be medial rotation. So just in case you're struggling with those ideas, that's what it means. Here we go again, loads of weird words. Calm down, don't panic at all. Right, flexion. You'd think that because you obviously swing your leg every time you take a step forwards, and every time you kick or run, you swing your entire hip joint forwards. There must be a big, very well-known muscle that does that. It's not. It's actually quite a small. It's called iliopsoas, silent P. So your iliopsoas is the muscle that swings the hip joint forwards when you're running. Now, what you can see here, it's actually not small. Why is it called iliopsoas? You don't need to know this, but it's just in case you're struggling. Look here, it says psoas major, P-S-O-S major, and iliacus. Now, these two muscles, even though there's a line here, actually join together. So they've taken the ilia bit from that one and the psoas bit for that one, and they call them iliopsoas. So the muscle that flexes your hip, swings the hip forwards, is an iliopsoas, right? Isn't it fun, this? In terms of extending the hip, so now we're looking at you from your front here. So if your iliopsoas contracts, this femur swings forwards. Now we're looking at you from behind here. And as you can see here is the biggest muscle in the body, the gluteus maximus. When you contract your gluteus maximus, that extends the hip, that pulls the hip joint backwards. It pulls the femur behind your body. The biggest, most powerful muscle in the body, because every time you jump, every time you drive off the ground, your femur moves behind you to drive the rest of your body forwards. So that's a big, powerful movement. Therefore, it needs a big, powerful muscle in order to do that, the gluteus maximus. Because you've got a gluteus maximus, you must also have a gluteus medius. And there it is there. You don't have a gluteus maximus on one side and a medius on the other. You've got a gluteus maximus there and a gluteus maximus there. You've got a gluteus medius there and a gluteus medius there, obviously. Two sets, one for each hip joint. When you contract your gluteus medius, that abducts the hip. So as you can see there, when this muscle contracts and shortens, it's going to pull this femur out to the side. So when you abduct your hip joint, when you swing your leg out to the side, that is the gluteus medius. When you adduct your hip, you contract your adductor longus. Now just think of this in common terms. It's an adductor because it creates adduction, and it's longus because there it is, look, adductor longus, it runs from there all the way down there. You've got an adductor brevis, which you don't need to know about. That means it's a short adductor. We're interested in the adductor longus, the long adductor. That is your prime mover. The adductor brevis isn't a prime mover. That's why we only need to know what the adductor longus is. Now your glutes make another appearance here. Lateral rotation, like we said, coming back to this diagram, there's that line going down the front of your leg. You want to twist or rotate your leg so that line is facing outwards away from your body. Again, that is a gluteus maximus. Look, that white bit is where it becomes a tendon. If I contract this muscle, it's going to pull my leg behind, but it's also going to rotate it so that the middle of my femur is pointing out. It's going to tug it that way. Equally, the gluteus medius is responsible for medial rotation. When you contract your medius, gluteus medius, that line will then rotate back towards the midline of your body. You have a gluteus minimus, i.e. a really tiny gluteal, but that's mainly just involved for stabilising the hip joint. It's not really used for a massive major action. So they're the muscles that you need to know for the hip joint. Okay, 2 to go, and it's relatively straightforward again from here. Why? Well, we're back to a hinge joint, aren't we? The knee joint is a hinge joint, same as the elbow, so again, there's only 2 movements we can get. They're flexion and extension. However, it's A-level, let's get nasty again, not me, the examiners. The hamstring muscle on the back, so there's the kneecap, there's your femur, there's your tibia, so we're looking at, the knee, so it's side onto us, there's patella there. Quadriceps on the front of your thigh, hamstrings on the back of your thigh. When you contract the hamstrings, that will flex the knee joint. It will pull, as you can see there, look, the hamstring is attached to the top of the tibia, the top of your shin bone. So when this contracts, it's going to pull the shin or your tibia behind you. So it's going to flex the knee joint. Here's the quadriceps here. Even though it looks like it's attaching here, it's not. It's attaching into the patella, which then attaches on the front of the tibia. So when I contract my quads, the force acts through here, and that's going to pull the tibia forwards, and that's what's going to extend my knee joint. However, they are muscle groups. Individual muscles make them up, so let's have a look. Oh dear God, what fresh hell is this? They've made it complicated, but we need to know these terms. I remember when I did A-levels, I'm going back many years, and I'm not sure enough, but I just had to sit and memorise these. And I got an A on my A-level, and it is down to that. There is no easy thing here, but if they were easy to remember, easy to memorise, everyone would have A grades. And that's not the point. Those of you that are willing to graft and work hard will remember the names of these muscles. But it's going to take time, and you're not going to get it first time. Don't get downbeat about it, is what I'm trying to say. What have we got here then? Well, as you'd expect, these 2 big muscles are made up of muscle groups. Muscle groups are made of individual muscles. The hamstrings is made up of 3 individual muscles. One's called biceps femoris. I thought biceps was in your upper body. It is, but you've got a biceps up in your elbow joint, but you've also got a biceps in your leg. Don't worry about it. Biceps means 2 heads. But you don't need to worry about what that means. In essence, it means that your biceps in your upper body attaches it as 2 different heads, 2 different attachments into the shoulder joint, and the biceps femoris in your hamstring has 2 separate attachments into the pelvis. Don't worry about that. It's just so you know that it's okay to have those 2 terms. You're going to get a question in the exam that could be what is happening at the knee joint. And if you identify that as knee flexion and write this is caused by the hamstrings, you won't get the mark. You will not get the mark. You need to put knee flexion and one of these terms, whichever one you think you have best chance of remembering. I go with biceps femoris. Why? Because the same applies to the quadriceps. Quads, there are 4 muscles. Rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. If you want to go and find their locations individually, please feel free. Want to look at them in an anatomy book, please feel free. But I'm just trying to, condense it all down. Again, if you see an action in the exam and it says what action is this and you know that it's in the extension and you put caused by the quadriceps, you will not get the mark. You need to put one of these muscles down. So I go for the 2 femoris muscle groups. Flexion is biceps femoris, extension is rectus femoris. Okay? But whichever ones you think you will learn best or memorise best. Finally then, the ankle joint, the last one, thank God for that. And again, there are only 2 movements we need to know at the ankle joint. You're looking at all these different muscles named on these diagrams. Don't worry about them. Dead straightforward. Plantar flexion and dorsiflexion then. The 2 that you need to know, there's your gastrocnemius muscle, this big one here, the posh name for your calf. But you can't put calf in the exam, it's got to be gastrocnemius. That plantar flexus. Remember, plantar flexion, P, point your toes. Every time you go up onto tiptoes, every time you point your toes to strike a ball through your laces or something like that, you are plantar flexing the ankle joint, and that is created by the gastrocnemius. Dorsiflexion is to draw the toes back. So if you look at the foot position here, imagine this person tries to pull their toes upwards and pull their foot back towards their shin, their tibia, as much as they can. That is done by the tibialis anterior. Remember, anterior means in front of, tibialis, the tibia. So the tibialis anterior is the muscle in front of your tibia, and that will dorsiflex your ankle joint. So they're the key movements and the muscles, the agonists that create those movements. That is a lot to take on board. So you need to, but you know, some of the joints are dead straightforward. The shoulder and the hip are the most complicated ones. Watch those as much as you can, as much as you need to. There's no hiding. You're going to have to know these if you want to get top grades in the exam. You could get asked short answer questions on them. 1 mark. You could get 10 mark questions on movement analysis, highlighting what's going on at various points of an action at the knee and the hip joint. You know, so you need to know what's going on at these joints. The movements are on a separate video. I'm also going to deal with types of contractions on a separate video as well.